Raise your hand if you've ever given your dog, past or current dog, a joint supplement and you have thought it's going to control their pain. I say this because I've talked to so many pet owners, so many dog owners. I see it a lot more in dogs and cats. Joint supplements, talking about arthritis, talking about pain. Oh, they're on conjoint. Oh, they're on glucosamine. And you look so proud because, yes, you are doing something for them. Spoiler alert, it doesn't do anything for their pain. It controls their inflammation, which can influence their pain. It is not a pain medication. And I see this commonly. And I don't know where the disconnect is for pet owners like you being educated in a sense that you feel equipped with this information. I don't know if it's on the packaging. I don't know if it's just something we as veterinarians could do a better job on educating on. So that's why I'm here to talk to you about your dog's arthritis and joint supplements and controlling their pain. And listen, if you haven't gathered by now, I very much like being able to do lifestyle adjustments to help my patients. And there's also a time when we have to lean into medications and pharmaceuticals. There is a time for that. Also, what can we do in their day-to-day life to help either lessen the dose, lessen the frequency, delay the use of those medications, or potentially maybe pull them off? Now, when it comes to arthritis, I can't promise you that we're going to pull your dog off of them. In fact, arthritis is a very, very painful condition. And I commonly see dog owners unsure that their dog is in pain from arthritis. And it's because dogs can't communicate pain the same way you and I do, where it's maybe reporting it. Oh, I'm achy today, or I'm slower, or I don't feel like going and working out, or I slept bad, or my shoulder hurts, or my hip hurts, or I'm just stiff. We have to look at them and they will tell us. So first I want to address what that looks like. That can look like slowing down, whether that is slower on the walks, whether that is slower to get up, whether that is slower to get down, whether that is slower to find a comfortable spot. It can be losing muscle. Arthritis is very painful. They're not going to cry and they're not going to yelp. That is very, very rare. I see that more commonly when there's an acute or sudden injury. That's when they commonly will do that. But they very rarely will do that. Sometimes they'll pant out of discomfort. And so controlling that pain is really important, but it's really important for you to look out and to know what to look for. And so other things that I want you to look for are difficulty going up and down the stairs. Maybe they're reluctant to jump on and off the furniture. And here's the big one, a change in their gait, a change in how they walk, a change in how they run. I commonly will also hear dog owners say, "Well, I don't think he's in pain," when their dog is limping. And then I have to question, okay, if you were limping, if you sprained your ankle, or if I very kindly nudged you in your knee and you hobbled out of here, why are you hobbling? Because it hurts. So when they limp, when they have a change in their gait, when they're holding a leg up, when they're shifting it, it's because it hurts. They're uncomfortable and they're trying to compensate. And so they're not going to yelp. They're not going to whine necessarily, and they're not going to cry. They're going to try and adapt and they're going to try and hide it. And it's our job to know them and to help them. And I will tell you, now this can definitely vary breed to breed because a 10-year-old Chihuahua is different than a 10-year-old Great Dane. Double digit age dogs, almost all of them have arthritis. They do. If your dog is considered a mature adult or senior based on their age and their size, there's a really good chance they have arthritis. So what can we do to delay it? And when they do have arthritis, what can we do to help the pain? Arthritis is an inflammatory condition. It is inflammation in the body. So what can we do to help manage that inflammation? And what can we do to help the pain? So joint supplements are great for various reasons. Some address pain or inflammation, some address joint health, but they don't really target the pain cycle. When I'm talking about pain, I'm talking about pain medications to help block those receptors that cause the pain. Whether that's a non-steroidal anti-inflammatory or commonly known as an NSAID. Maybe your dog has been on it before, Rimadyl or Carprofen or Vetprofen. Sometimes we use gabapentin. There's a variety of different things that we can do for the pain. but also what can we do for the inflammation? So joint supplements, I think, are a great product. So I'm not saying that joint supplements aren't good. What I am saying is that they are not the only modality for pain control. And so you can even prophylactically or precautiously start your dog on a joint supplement at any age before the showing signs to help with the joint health, to help with the soft tissue health, to help with the inflammation. And so what does this look like? Glucosamine and chondroitin, commonly, I think those are the most commonly known ones. You've seen them in products maybe like Dasaquin, You. There's a variety of ones out there. There's ones that are just labeled joint supplements. That is great because what that does is that helps protect the joint tissue, which is really important. Also, omega-3s. You've heard me talk about omega-3s. Omega-3s are great for inflammation. They have a multitude of reasons they can be used for the coat, for the heart, for the eyes, the joints. They're beautiful for joints and inflammation, especially for swelling inside the body, inflammation. Beautiful. There are other products that I feel like have been a little bit more popular lately that are also wonderful. Green lipid muscle, that is a wonderful product as well. That is very rich in other omega-3s. Again, omega-3s help with inflammation. So adding a different variety of it can be really helpful with managing your dog's inflammation, which can influence their pain. And the green lipid muscle can help your dog stop from making these chemicals that cause pain and swelling. Again, there's this like cascade of inflammation, but sometimes, especially when your dogs get to the point where they are so arthritic that they have lost muscle mass, that is affecting their gait, it is affecting their ability to get up, it is affecting their ability to sit down, it is affecting their walk. That is when you need probably a little bit more, some pain control. Egg membrane, so that membrane that lines the shell, so eggshell membrane is also used sometimes to help with inflammation. So these are ingredients that you may see. Turmeric. Turmeric is wonderful for inflammation. Wonderful for inflammation. Boswellia, MSM, those are also wonderful ingredients for you to look at when looking at products for joint supplement, joint support, arthritis support. Here's the thing, though, that I want to highlight with some of these products. And this is where it is so important to what are you looking for, but also what are you not looking for? What do you not want in these products? That to me is equally as important as what you want in a joint supplement. Even if you're being proactive and you're like, hey, I have a 4-year-old dog who's a large breed dog, or they're active, or they sustained this injury, they had torn the cruciate, or I know this breed is prone to hip dysplasia, or I just know my dog by the grace of God, is going to get older and they're going to develop arthritis. Is starting that joint supplement, is being mindful of also what's in it that you don't want. So looking at the ingredients, trying to keep down as much inflammation as possible. So are there extra sugars or carbs added? Now you have to also look at the nature of the product, how it's formulated. If it's like a chew or a crunchy or like treat-like structure, it is likely going to have something in it to help keep it formed and shaped. So look at the ingredients. Again, I'm going to say this and you're going to hear me repeating it. Don't just look at the front of the product. Don't just look, oh, it's omega-3 and it's got green lipid muscle and it says joint supplement sold. And it may be a great product. But let's also look at the back. Does it have molasses and rice syrup or other possible ingredients? Is it loaded with these that are carbs, starches, sugars, carbs, starches, sugars? I'm not demonizing them. What I'm saying is let's be mindful, especially if your dog is, let's say, on a very carb-rich type of food. And now we're adding more starches and sugars to their nutrition. Okay, are they just constantly getting this? That, yeah, we're helping some, but also we have products, ingredients that are, yeah, they're kind of diluting the efficacy of them. So being mindful of that. Is it filled with canola or vegetable oil? And I can speak to this. I had my dog on a joint supplement that I was getting from a colleague, a friend of mine, because she was getting it in bulk. And as many of you may or may not know, I travel full time for my career. I'm not at one hospital. I'm a travel relief veterinarian. So I go hospital to hospital. And so she was doing me a favor. We've been friends for years and years and years, and she was sending it to me. And then finally I was like, I feel so bad. She's putting it in the mailbox. She's sending it to me. So I decided to get it on my own. And I thought I got the same product. I fell trapped to it. I'm raising my hand that I fell trapped to, I thought it was the same product. I purchased it. I got it at home and I was like, man, it just looks different. I looked at the ingredients and there was vegetable oil, there was brown rice syrup, there was molasses. Again, it's just added possible inflammation for my dog. If I'm giving him a joint supplement to help prevent any issues with his joints, to keep that inflammation down, to keep those joints healthy, I'm sure as heck don't want to add vegetable oil to it. That's not what I want in there. And so I went back to square one and started it again, but with a different product or different variety of that product that didn't have it. So really be mindful of the ingredients in it. Don't just chase the glucosamine, the omega-3, the green lipid muscle, the eggshell membrane, the MSM, the boswellia, the turmeric. Yes, those are great. Also, what is in there with it? You don't want to dilute the efficacy of what you're giving. Also, you don't want to dilute the efficacy of your dollars on how you're investing and spending your money, right? And so, yes, your dog may, these are going to help your dog, but your dog also at some point may need pain control. And I will tell you, one of the biggest pieces of advice when it comes to arthritis, as soon as your dog is showing signs of arthritis, do something about it. If they're already on a joint supplement, that is great. Ensure that that joint supplement is not having any ingredients to dilute the efficacy of your goal with it. If you've confirmed that, then it's probably time for some pain management in the form of a prescription of some sort. If you're not already on that, you absolutely can try that. And I've had some owners say, oh man, when I started this joint supplement, I saw a difference in my dog. That's great. I love hearing that. I love when supplements can help us bridge the gap, get us closer to our goal with our dog's health, our pet's health. I love that. Also, it probably helps control a little bit of the inflammation, and you're probably at some point still going to need some prescription pain meds of some sort, whatever is best for that dog based on their health and you. I think, and I say it sometimes too, the dog's health, the cat's health. It's important, but also you too. Are you able to medicate your dog orally? Are they picky? Is it hard? Can you afford it? Like we have to look at a variety of options. And so when it comes to that, here's a little side note, is making sure your dog is an ideal weight. That is the most affordable thing you can do. And that will help with your dog's arthritis. It will help with your dog's inflammation. When dogs are overweight, that's also an inflammatory condition. So you have arthritis and you have overweight. By golly, you have inflammation, inflammation. You have bonfire feeding a bonfire. And so I get it. Arthritic dogs are painful. And so maybe they're less likely to want to move. Also, I believe a body emotion stays emotion. And then being overweight creates them not want to move. And so there's other ways we have to address it. And controlling their inflammation is one. Controlling their pain is probably another one. And there's also a variety of different things that we can do in addition or in place of prescriptions if we need to for patients. This was years and years ago. This was probably back in 2017, 2018. I had a patient, a geriatric miniature poodle, who had really significant kidney disease. So we were really limited on pain meds that we could do for this dog. And so we used laser therapy. And laser therapy helped this dog tremendously, also with pharmaceuticals and supplements. There's other modalities out there. There's acupuncture. There's laser therapy. I personally have never had chiropractic work done on my dogs. I've had some clients rave about it. There's other modalities that we can do out there. There's joint injections, so not necessarily in the joints, but there's Adequan, which is an injection. Some hospitals are now starting to do PRP. There's rehab. There's a lot of different varieties that you can do. So some tips too for your dog if they're arthritic, because these are also common topics that I will have with owners, is that their dog is arthritic, they're seeing they're slowing down, and let's say they are controlling the pain with supplements or with pain medications and controlling the inflammation and the joint health with supplements, is that they're not walking them as frequently, and so they think one long walk a day is better. They're like, well, it hurts for them to walk, so I'm only going to take them out once, but I'm going to go a mile and a half. Probably too far. Now, every dog's different. Absolutely. Also, what were they used to doing beforehand? Were they doing 5 miles a day where 1.5 miles is drastically cut down? But I am the believer that short, frequent walks are probably more beneficial for your dog rather than one longer walk. It is shorter movement, again, that body emotion stays emotion. It's going to be a lot more valuable to them. Also, walking them going out in the yard and just going around and walking is not intentional movement. And so if that means you walking in the backyard with them, that's fine. But they need that movement to sustain their muscles, to keep those joints lubricated while being mindful of the status of their arthritis. And sometimes it takes imaging, x-rays to look at their arthritis, and that way you have an idea. Now, I wouldn't say just because x-rays don't show significant arthritis doesn't mean they're not in pain, but it maybe lets you assess it, and that's something you can always recheck. So I know that this episode was meant to talk about supplements and pain control, but these are other tools in your toolbox I want you to be aware of and how they do hold value. The x-rays being recommended aren't just to have you leave with a bill. They're to, hey, let's see how bad maybe those hips look, or the spine looks, or the shoulder looks. Do we see a lot of bone remodeling? Yeah, okay, this does look pretty gnarly. This is going to be something that we're going to have to really manage. Or, it doesn't look that bad. So let's start conservatively with management, and then we'll add in as needed while taking into the dog's pain tolerance and pain threshold and lifestyle. Does the dog have to go up and down stairs daily? There's so much that goes into it. But the biggest thing I want you to know is that joint supplements are not pain medications. They can help with joint health. They can help with inflammation, depending on the ingredients. They don't control the pain cycle. They don't block the pain receptors. And so when you get to that point where you're on the joint supplement or your dog is visibly showing signs of arthritis, we probably need to do the pain receptor medication, the medications to help block that pain cycle that they're feeling so that they are more comfortable. So they do want to move around more, so they can sustain their muscles. So that way they're not harder to walk, harder to get up. And so many dogs are just so honest. They're house trained and it's hard for them to get up and go potty. And I mean, there's a whole cascade that can go into this. And so here's the biggest tips. Here's the biggest takeaways I want you to be aware of. Your joint supplements are great for joint health and potentially inflammation. They don't deal with the pain receptors and the pain cycle necessarily. Keeping your dog at an ideal weight is going to help tremendously, not only for like the load on their joints, but decreasing their inflammation. Being mindful of what else is in the joint supplements. Being mindful of what ingredients are in there. And hey, if you need that one-on-one support for someone to sit down and talk to you and make the time, 40 minutes of undivided attention with having a history beforehand, schedule that one-on-one nutrition consult with me. We will absolutely talk about that. We can talk about that in the consultation. It doesn't have to just be their food. We can also look at their food too and make sure that their ingredients in their food are working for them. Short intentional movement is way better. If your dog is losing muscle in the back end, let's say you look at them and you're like, wow, their back end has like no muscle. You're not going to rebuild it. But I always like to talk about sit-stand exercises. Those can be really valuable. They're like us doing a squat. And so what I will tell you is if your dog can't sit all the way down, don't make them. Wherever their depth is, just like me doing a back squat is going to have a lot different depth than someone who's potentially 80 years old who's never worked out before. So being mindful, kind of checking the temperature on that. But the biggest thing is I want you to know, this is a conversation I have at least once or twice a week in a clinical setting, is addressing the arthritis with pet owners and seeing it, what you need to look for. Again, it is slowing down. It is maybe having a limp in their gait. It is difficulty standing, difficulty rising, potentially falling down the stairs, having difficulty getting up and down the stairs, jumping on and off the furniture. They're not going to cry out in pain most of the time. They're not. There's going to be other clues that we really have to look at. And just being aware that at their age and their breed, they probably have signs of arthritis. It's just such at the cellular level. So using the joint supplements to support them, it is a supplement. Pain medications are likely going to be needed. It's just a matter of when and how much and what kind, and what can we do to support them so that we can lower the dose, lower the frequency, keeping them at an ideal weight, being mindful of the ingredients of what they're eating, the good and the bad. Intentional movement. You can do this. You being equipped with the knowledge is the first steps that you are aware, and being aware that it is painful, being aware what to look for the pain, being aware for what to do at home to support them, and when to lean in for us as veterinarians to help you. I hope that you found this episode helpful. If you haven't yet, I really invite you to leave a beautiful review on Spotify or Apple or even YouTube, depending on how you listen or watch this. I look forward to the next episode.